My name is Kim Mayer, and I'm with the California Institute for Behavioral Health Solutions. We are a contractor to the California Department of Healthcare Services, assisting with planning for therapeutic foster care implementation. Joining me today are two staff from the Department of Healthcare Services, Kathleen Carter-Nishimura, and Kelly Bitts from CIBHS is providing technical assistance. Our purpose today is to provide a high-level overview of the purpose of our Foster Care Implementation Committee. We're also going to share the history of our committee and how it has evolved over time. Throughout the presentation, using the acronym TFC for Therapeutic Foster Care. So here's an overview of what we're going to cover in this orientation. As you can see, TFC is part of the KDA settlement agreement and the core practice model. Overview of KDA and also some of the key concepts in the core practice model. We will also share some information related to the Department of Social Services Continuum of Care Reform and linkages with TFC. So now I'm going to turn this over to Julia.
Thanks, Kim. The KDA to a class action lawsuit that was filed in the Federal District Court in 2002. KDA, for the case, was a 14-year-old girl at the time the lawsuit was filed that had been placed in foster care for 10 years and moved through 37 different placements, including 4 group homes, 19 stays at psychiatric facilities, and a 2-year stay at the Metropolitan State Hospital, and 7 different stays at the McLaren Children's Center. Early assessments had indicated that she was a victim of trauma and needed intensive trauma treatment and supportive services for a caregiver. The lawsuit overall concerns the availability of intensive mental health services to children in California who are either in foster care or at imminent risk coming into foster care. The settlement was reached in the case in December of 2011, and child welfare and mental health leaders from state and local levels are working together to establish a sustainable framework for the provision of an array of services that occur in community settings in a coordinated manner. The settlement agreement addressed the need for children and youth with more intensive needs to receive those medically necessary mental health services in their own home-like setting appropriate to their needs in order to facilitate reunification and to meet their needs for safety, permanence, and well-being. On the slide, you can see the objectives to the case. The settlement agreement also ensures that services are coordinated, taking into account the child's or youth's family, voice, and choice. Since February of 2016, membership in the subclass is no longer a prerequisite to receive ICCS services. Jurisdiction over the KDA settlement agreement ended in December of 2014. However, the department continues to ensure that the efforts originating under the agreement keep traction. One such effort has been getting approval for and implementing therapeutic foster care as a Medi-Cal reimbursable service. To ensure the important goals and services under the settlement agreement are and continue to be a sustainable and regular course of business beyond the end of jurisdiction, they were debranded and are now called Pathways to Mental Health Services.
Thank you, Julia. This is Kim again. So I'm going to give you a little bit of an overview of Pathways to Mental Health Services. So Pathways to Mental Health Services include 3 services for children and youth who have greater needs and who require more intensive services. They are Intensive Care Coordination, or ICC, Intensive Home-Based Services, or IHBS, and Therapeutic Foster Care, or TFC. And just to give you an overview of what and define these services, Intensive Care Coordination, ICC, is a targeted case managed service that facilitates assessment of, care, planning for, and coordination of services. Intensive Home-Based Mental Health Services, or IHBS, are mental health rehabilitation services. IHBS services are individualized, strength-based interventions designed to ameliorate mental health conditions that interfere with a child or youth's functioning and are aimed at helping the child or youth build skills necessary for successful functioning in the home and community, and improving the child and youth family ability to help the child successfully function in the home and community. The third service is therapeutic foster care, and we will discuss that in more detail later in the presentation. This next slide gives a little bit of an overview of the core practice model. And one of the key components of the KDA settlement agreement is a practice model that can be utilized across community agencies and county departments in child welfare and mental health. In California, practice is changing with regard to the way child welfare and mental health staff and service providers work with children, parents, and families who need both child welfare and mental health services and supports. The systems that serve these children and families must work together to improve outcomes for children, youth, and families who have mental health needs are involved in the child welfare system. And as you can see from the content on the slide, that the core practice model should be a guide for implementation of the expectations of practice, the required elements for fidelity to the model, and approaches to implementation. So another key component of the core practice model is the concept of child and family teams and also teaming. The practice of teaming for all youth and families receiving services is at the heart of the core practice model. The concept is core to the core practice model of child and family teams. Working as part of a team involves a different way of decision making. Child welfare, mental health staff, and service providers and other family members and service providers need to become knowledgeable and comfortable about working within a team environment that engages youth and families as partner in that environment. And if you'll see some of the key concepts, the team is composed of the youth, the family, the natural supports, child welfare, behavioral health, and any other ancillary individuals that are involved in the youth treatment. It's not just a meeting, but really working together. And the composition of the frequency of meetings and facilitation is really based on the youth and families' needs. So I'm going to turn this over to Kathleen to talk more about therapeutic foster care.
Thanks, Kim. So therapeutic foster care is the third service in the Pathways to Mental Health Services menu. The service definition is going to be covered in the next 3 slides and comes straight from our proposed TFC model. As we'll discuss in more detail later, the model was developed and continues to be fine-tuned by a group of varied and interested stakeholders. So the first thing you're going to want to know about TFC is that it's a short-term, intensive, highly coordinated, and individualized rehabilitative service covered under Medi-Cal that's provided to a child or youth up to age 21 with complex emotional and behavioral needs, who is placed with specifically selected, trained, and intensely supervised and supported TFC parents. The second element of TFC is that the TFC parents serve as the primary change agent for the therapeutic treatment process of the child and youth. So the key takeaway here is that parents will be providing a Medi-Cal reimbursable service. The last thing that we really wanted to impart upon you about TFC is that the services assist the child and youth in achieving client plan goals and objectives and help the child and youth remain in the community setting, which means they're avoiding residential, inpatient, or institutional care. So it's important to note that the receipt of TFC does not limit the availability of other specialty mental health services, and that TFC parents are not expected to provide other specialty mental health services that may be medically necessary. Now we'll talk a little bit about the planning of TFC. So when the settlement agreement first came out, the TFC subgroup was formed in March, in response to the agreement and as part of the implementation plan during court jurisdiction. So this TFC coverage and model subgroup reported to the larger core components work group, and the purpose of the subgroup was to do two things. The first was to determine a package of integrated activities and service components in TFC to be covered under Medicaid. And then the second was to develop a TFC model that is treatment-driven and centered. So this slide kind of shows the evolution of the TFC subgroup. So if you look at the big circle on the left there, that's when we reached the agreement of the reached agreement in the settlement in December 2011, and then at the top bubble there is when the core components work group was developed in 2012, and then in March of 2012, the TFC coverage and model subgroup was formed and met through December 2015. And then beginning in January of 2016, the subgroup transitioned into the TFC Implementation Committee.
Great, thanks, Kathleen. So in terms of the TFC Implementation Committee, their role is to advise the Department of Healthcare Services, or DHCS, on the design and implementation of TFC. And these are whom our stakeholders include, which is the Department of Healthcare Services, the Department of Social Services, the County Behavioral Health Directors Association, or CIBHS, the County Welfare Directors Association, CWDA, providers and provider associations, probation, youth and parents, and advocates, and others. And that's basically whom are involved in our different, our committee so far. So this slide basically outlines the different implementation activities that we've been doing with the committee's advice, and also the work that DHCS is doing to roll this out. So DHCS has developed a draft timeline for over the next 18 months that's focused on 4 different areas: TFC design and stakeholder input, which is what we're in right now, training and technical assistance, claiming and IT, and guidance and evaluation. The TFC design and stakeholder input includes our current work with the TFC Implementation Committee and the 2 ad hoc groups on documentation and certification and credentialing. It also includes finalizing the TFC model, the TFC parent qualifications, and other documents as appropriate. Training and technical assistance focus on assessing training needs and developing and implementing a training plan, and then ongoing technical assistance once TFC is implemented. Claiming and IT focuses on identifying the state short-trial Medi-Cal 2 and IT system changes. This is followed by county short-trial Medi-Cal 2 and IT system changes. Guidance and evaluation focuses on state guidance to mental health plans through all county information notices, frequently asked questions or FAQs, a TFC addendum to the Medi-Cal manual, and other necessary tools to support implementation. Many of you are also familiar probably with the California Department of Social Services Continuous Care Reform, or CCR. We have included a 2-page fact sheet about CCR that highlights the important changes in the foster care system that will be implemented over the next several years. The Continuous Care Reform draws together a series of existing and new reforms to child welfare services programs designed out of an understanding that children who must live apart from their biological parents do best when they are cared for in a committed and nurturing family home. Some of the areas that have been identified as linking with TFC are the resource family approval process and the foster family agency requirements. And there's also been a lot of coordination efforts between CBSS, recognizing that this is a lot of joint work that we do here. DHCS and us, we are not experts on CCR, which is why we wanted to refer you to the fact sheet that we've attached. And we can also refer you to some other websites also. So with that, we're going to take some questions at this point. We have time for questions, and hopefully we have some questions in it. Do we have some questions yet? So if you have any questions, this would be a good time to type them into the question box, and we will wait for that, and then Kelly will read your questions, and we will have one of the presenters answer your question. So any questions, anybody? Feel free to type them into the dialog box. Anybody want to ask any questions? Going once? Great, we have some questions. So Kelly's going to read the question.
When you mention provider organizations as stakeholders from whom you are seeking input, what type of providers are being involved?
I'll turn that over to DHCS.
We have both mental health service providers, we have foster family agencies, we have associations like the California Alliance. Anyone else that you can think of?
We can, let's see, yeah, we've got the California Alliance of Child and Family Care Network. That's also on our list. Let's see, the Redwood Community Services. We've basically taken some of the, tried to get a representative group of people to represent the different kind of like smaller groups of providers, like bigger ones that are more statewide. We wanted to include associations as well. So since we can't include everybody, that would just end up being a little bit too unmanageable. We wanted to get representative stakeholders. So we tried to get a array that would represent different interests appropriately.
Great, thank you. Next question?
That's the only question.
It's the only question we have. All right. We have a few more minutes here. If anybody wants to enter any other questions into the question box. Okay, so, all right, so just in terms of wrapping this up today, do you want to go to the next slide there, Kelly? We have two upcoming TFC Implementation Committee meetings, one on Tuesday, March 29th from 2 to 5 at CIBHS, and the other one on the calendar is Thursday, April 28th from 10 to 4, also at CIBHS. And for those of you committee members, you will be getting information on those. After today, if you walk away from this webinar and you have further questions, we're leaving you with the email address which is kda@dhcs.ca.gov, and also that we will be, eventually we will be posting a recording of this webinar on a website so that we can have more information on that. So please, thank you for your time today. If you have any more questions, please feel free to email us at that address, and thank you for your time.